I want to now introduce you to the patient-reported indicator survey, because we are not the only people interested in this. Ontario are not the only people interested in this. This is a global effort that has been recognized by PaRIS in the PaRIS surveys, and we've been supporting this work for the last number of years, and we'll have a few speakers now talk about this initiative. And really starting to have PaRIS as the basis for comparing across health systems, that it's not just about some clinical marker, it's actually achieving the health outcomes and positive experiences. So 2 of those domains, and we will again also look at equity. So 3 domains of the quintuple aim framework. I'm going to go quickly just to introduce, you can't read this slide. It's not meant for you to read. It's just intended for you to know that, PaRIS was developed understanding facility, organizational system design, patient-reported experiences, what patients' own health is, and what their behaviors are, and how those then lead to overall outcomes. So this is the entire framework. The final survey had 137 items on it. So people who responded to this survey, and there were many, made quite a time commitment. We need to really maximize the value of this tool, and the intention now is it will become a standard international tool for collection every couple of years. I'm not going to go through all the items. I'm going to dive into just 10 of the areas that are now in the report. That QR code points you to the OECD website, where you can find the PaRIS surveys and the report that was released literally fresh off the press last Thursday. We were unable to be as public about our dissemination until the OECD had their release, which was in Portugal last Thursday. They have 10 measures at the top. Some of them on PROMs, 5 on PROMs: physical, mental, social health, general health, and overall well-being. And then in the area of patient-reported experience measures, they have mostly scales, but they have 1 item on confidence to self-manage. And just most people in the health system are really driving towards the value and importance of this capability. And then there are a number of scales around coordination, person-centered care, and overall experience quality, which is very much like the Commonwealth Fund of an overall experience quality. And there's a question across health systems around trust. Let me just pull into just a few of these results. The definitions are here for those who can come back later and see more specifically. So let's go past this and the experience. Great. So just to let you know, I'm going to show you results from 107,000 people from across the globe, from 19 countries that participated. 17 being OECD members. In Canada, because we didn't have a registry, some countries had a registry of all the primary care practices, like a list of all the primary care practices in the country. Imagine that. It's a good way to help people get attached to primary care if you actually know where they are. But we had a convenient sample. We put out a call and we invited primary care providers to join and then distribute surveys for us. On the next slide, you'll see that we've been participating in this, and we've been supported here in Ontario by the Ontario SPORE Support Unit. That's a CHR-funded entity, co-funded by the Ministry of Health as well, and we receive funding from them to support this work. In Canada, almost 4,500 patients are participating, and either partially or entirely completed the survey from 52 practices. And I'm going to show you, when you see Canada's data, the next slide shows you who participated from across Canada. So 5 practices from BC, 8 in Alberta, 10 in Manitoba, 8 in Saskatchewan. No, that's Alberta, 10 in Saskatchewan. Do I know my geography? 13 in Ontario and 15 in Quebec. And we're going to see a lot of the results from Ontario and Quebec today mostly, but all of Canada's results. On the next slide, you'll see we're starting to prepare these reports, and these will become imminently available now that they've been released publicly by the OECD. We have a national report, and we have provider reports in Ontario. And you can also, on the previous link to OECD, see the OECD overall report. And we're also providing practices back their own survey results in comparison, and you're going to see a lot more about how we're doing that. Okay, just a flavor of how does Canada look compared to the other countries. So this is our physical health compared to the respondents. So this is the physical health for people with chronic conditions in the darker blue and without chronic conditions in the lighter blue behind. So always people without chronic conditions have slightly higher health. You can see actually our health status, there's not a huge amount of variability across the countries. We are near the top, but there isn't, as I mentioned, a lot of variability across this. In our mental health, on the next slide, we're just slightly down. There's quite a bit more variability in this item, mental health scores for people, and we're still doing relatively well to other countries. The respondents to this primary care survey reported better mental health than that from other countries. And these are kind of standardized scores, so I can't give you a direct interpretation of that score just below 50. It's been standardized to have the score across all countries be 50. And then it's all relative to that. So on the next slide, we have these results reported by province. So in our own national report, we will take this data and unpack it by province. And so you'll be able to see. And, there is some variability in self-reported health across the provinces. Ontario has apparently fairly good, with more people with excellent or very good health, but also still some people with fair or poor health. We also have the self-reported mental health as well. And bothered by emotional problems is how this is recorded right here and now. Again, variability across the provinces. So that's the kind of overall health. I want to talk more about the experience items. So in the PaRIS survey, I want to come back to that confidence to self-manage. You see, this is an area where Canada could still be improving. There are many countries that feel that they're in better position. In France, the Netherlands, Saudi Arabia, Czech, Switzerland, all better than Canada. And there are a few countries that are not as strong as Canada, but still lots of opportunities for us here to improve. And I think that's really essential and part of what we're really trying to drive at through patient engagement. We also can look across the country in this. First experience coordination. That's fine. Okay, great. If you can go back one, Lale. This was a slight edit. This is in experienced coordination of care. So how well is care coordinated across Canada as reported in comparison to other countries? So there are places where it is better, Australia, Switzerland, Romania even, being better coordinated, but we're actually doing reasonably well compared to other countries. And now let's see within Canada, also talked about, what's important to people in managing their health and well-being. So this part here is one of the sub-items on that good coordination that they have, what's discussed about you. And we see some variation across the provinces. Manitoba doing a little bit worse than other provinces, but also all the provinces having lots of room to improve. There's still quite a bit of area around the red and yellow here, which would be areas to improve. On the next slide, we actually just want to show you that this varies even within Ontario. These are 13 practices that participated in this tool, and you see quite a bit of variability even within the practices within Ontario. So practice 2, about 58% said that they always discussed what was most important to them, whereas that was only 35% in practice number 8. On the next slide, the last point I'm going to make, are people involved as much as they want to be in their care decisions. And here also we see a fair bit of variability. Practice number 2, more than 85% always. And then in practice number 8, only 45% saying always. So really opportunities for improvement here. And this is the kind of work that we need to be able to do to generate and demonstrate value.